Everyone, it's Dr. Greg Jones, and I am here at ISSCA 124 in Buenos Aires, Argentina. You want to do this regenerative injection, even something simple as like a PRP, even that, it's like, look, you want to build a new building and the neighborhood around it's on fire.
Take out the trash first, and then before you build the wall. If you don't sleep, if you just sit on the couch and don't move, and if you eat processed food, seed oil, sugar, nothing's gonna give you the result that you hope for. So it doesn't matter, how much stem cell exosome that you put in there. It's not enough. There's no one single magic thing. I switched to asking what makes the cell fail, what's the root cause, and then I became patient number one.
Everyone, it's Dr. Greg Jones of the Greg Jones Optimization Academy podcast, and I am here at ISSCA 124 in Buenos Aires, Argentina. And we're doing something really cool today. We're doing a combination. It's a team. It's like a super friends, like the Avengers. Like, we're coming together with ISSCA and my podcast to talk to some of the leaders in regenerative medicine and some of the most influential and progressive doctors in the space. And it's my honor to be able to interview these people. So this is a little bit different. Normally in my office, I'm hanging out, I got my coffee, I got all these things. We're here just to talk. And I got some amazing guests today, and we're gonna kick this off. So this is a great treat for you all, it's a treat for me, and we'll get going. So my first guest today is Dr. Khanh Nguyen, an amazing doctor out of Austin, Texas. I've known her for years. I always see her at conferences. She always comes up asking these hard questions. Hey, I have a question for you. When you said on stage, I'm like, oh gosh, I gotta run from this lady. She's so smart. She knows her things. But it's always a pleasure, man. And I really wanna get a little bit of background on you because you came to the US in 1982. And you started off in internal medicine.
Right.
And then you pivoted at some point to regenerative medicine, and this is what you're doing. So what was kind of like the genesis? What made you make the switch?
Yeah, I started out in internal medicine and critical care medicine. And I've done that for a decade. And so, with my foundation, I'm really good at making diagnosis, rescuing, stabilizing patient, and then treating symptoms. And, we're pretty good at that. But what I've noticed over the years is that patients are coming back and sicker with a longer list of medication. And that made me kind of sat back and started to think and to ask another question. Instead of what are the symptoms, what the diagnosis, I switched to asking what makes the cell fail, what's the root cause. And then I became patient number one when I got burned out and I got diagnosed with pretty severe thyroid condition, Graves' disease. And I forced to really go deeper and trying to heal myself. And that's kind of like the beginning of functional medicine, cellular medicine, and regenerative medicine. And since, never look back, because more and more I really appreciate the cells and the body's own ability to heal, to repair, and to regenerate. And our job is just really to help that, put the cells back into doing what they know was best to do.
So I think that's so important because I think a lot of us, we're patient number one, right? It's either us or our family.
Right.
Someone we love and someone we care about that's like dealing with something and they're just not getting the answers and they're just not getting better.
Right.
And there's that frustration, right? There's that frustration and sometimes it can make someone feel helpless, right? Because they're taking the medications, they're following the doctor's instructions, they're doing all these things. And it's like, there has to be a better way. And so doctors like yourself, you become the better way.
Right.
And not just in helping yourself, but when you get to start helping other people, because now on top of that, you have a story, right? You can say, hey, like, I'm not just doing this, I believe in this, right? But what's interesting with you is I see you're educating other physicians too, like you're teaching the next generations of doctors, right? So what gap did you identify, or kind of like with that, like what made you say like, hey, you know what, like I want to share what I've learned as well?
Absolutely. I think the traditional education is valuable. I learned all the fundamentals, the physiology, biochemistry, how the body works. The gap, I think, is the fundamental difference in how we go about treating diseases and symptoms. It's the way it is, it's very reactive, it's symptom driven, and I think we need to educate the next generation how to go upstream, how to look at the root causes, and that would be the best way. It's more into a proactive, thinking of the body as a one whole body with a very intricate, interconnected system, and not just the heart isolated and the lungs and the kidney, but they all communicate, they all signal, and they all play together like in a symphony. So I think that's the difference.
Yeah. So you're building upon the foundation that they've learned in school, right? Because we only get to learn so much in med school, right?
Right.
Med school is very much like, it's amazing. It's so much we have to learn.
Right. And it's like, okay, you have hypertension. Step number one is this class of medication, and then you go to the next one. If you have pain, you start out with NSAID, and then, morphine, narcotic, and then steroid, and then surgery, right? So very reactive, very symptom driven. Now we realize, okay, the cell is trying to adapt, but it's become maladaptive, and that's what present as symptoms. And so we have to go backward, go all the way at the cellular level, look at what failed, and try to help the cell to get back into being able to be adaptive again, to react in an appropriate way.
Oh, absolutely. And I always feel like when it comes to that, I'll leave the education piece alone in a second here. I feel like we're taught, they teach you how to be safe. Right, at the end of the day, that's the job. It's like you're about to get a medical license and get out there and treat patients. We need to make sure you're not going to do something stupid. Now it's upon you to learn how to be the optimizing doctor, the preventative, not just reactive. How do you actually get people better? That's the education you have to go get, right? Because again, like someone comes in with a hypertension, it's like you're having a hypertensive emergency. What do I need to do? Not like you're just a little hypertension, so let me work on this herb or this supplement or this peptide. And so I think that what you're saying is something I think everyone needs to know. It's like, if you want to become that next level physician, there's some work you need to do.
And even normal is a lot of times it's not acceptable, right? We want to go even to the optimal range of everything. Why not, right? So that is another thing that, I started to educate, to make aware, even including patients. And get the patient to be a co-partner in their health journey, and help them to know their biologics, know the important numbers that will move the needles, and then together we have a plan, and and not just waiting until it's too late and then just suppressing the symptoms. And we know that that's not effective.
So I want to shift gears a little bit and talk about regenerative medicine. And I love your Instagram page because, like, sometimes I'll do a post and I'll get some negative comments, and I'm like, I let it go. Dr. Nguyen, you gather people, you sit them down, you educate, right? And you're just like, look, and I appreciate that, because sometimes like, oh man, they shouldn't have said that to her. Oh, she's gonna correct, because I think that needs to be that, right? That little bit of a pushback. But here's a question for you, because I think a lot of the confusion comes into, and I want to frame it this way. Let's say a vendor or company says, they call your office and say, hey, Dr. Nguyen, we're going to talk to you about stem cells, right? And they're going to come in, they got the PowerPoint presentation. And sometimes you realize, like, you're not trying to get my office, we're trying to sell us stem cells. This is a different product, right? So when it comes to that, when someone says, hey, this is a stem cell, what makes it a stem cell versus like a different biologic medication or biological? Right?
So, by definition, there's a lot of confusion out there. But by definition, stem cells are basically, they're like the master communicator cells. They have two main jobs. One is the ability to divide and multiply and make more of them. And then the other path is to become a more specialized cell. So that's by definition, that's stem cell. And then in the regenerative toolbox, we have many options. Even the mesenchymal stem cell, we all still make those cells. They're in bone marrow, they're in fat, and then we have exosomes, which is kind of a small vesicle inside stem cells. And I think of that like the active ingredient of stem cell, because they really are responsible for signaling the body with the right instruction, like know what to do with the injury. And then, we have birth product stem cell, the umbilical cord products. So there's just a lot out there. And I think as physician, it's really important to look at data, to ask deeper and better questions, and just keep on learning and leaning on organizations like this one, because I'm honored to come as a speaker, but I learn new things every time, and I rely on the scientists, on in the lab to do the work, and then I gain the benefit of being on the clinical side, applying for patients. But the most important thing is safety, right? Safety for patient, that's the most important thing. So it's always a lot of confusion, a lot of noise, a lot of products. And I think you just have to step back and be curious, look at the data, really learn, keep on learning, and again, rely on the right team to guide us.
So you mentioned a few different, regenerative products, regenerative options for patients.
Right.
When someone comes to your office and they're like, hey, my back, for an example, I've had this low back pain, this spinal injury, and it's been going on.
Right.
I've done all the things.
Right.
Because you have this great kind of toolbox of options, how do you make that decision, or what drives you? Obviously, case by case, but what helps you decide like that level of you need a stem cell versus, you need to stop eating pizza?
Right.
I know that's kind of a wild example, but yeah.
So the answer is all of the above. First of all, I don't look at what product should I use. I start out with what's the phenotype, what's the failure that the cell can no longer do, and what's the environment in the body. And then the sequence is just as important as the tools in the toolbox that we use. Meaning, a lot of time I use therapeutic plasma exchange, and I would remove the old inflamed plasma before using any of the biologic. And that alone is making the products a lot more beneficial, because now whatever product that you use is now based in a healthier environment. So we have to think of different levels, down to the foundation, which is lifestyle, right? As you mentioned, we have all these fancy options, but if you don't sleep, if you just sit on the couch and don't move, and if you eat processed food, seed oil, sugar, nothing is gonna give you the result that you hope for. So I think it's very individualized. I always look at what's the failure point, and I look at the patient, the family history, the genetic, the lifestyle, all the lab numbers. So it's truly, it has to be that, and not just one rigid protocol. You start out with A and then go to B and C, because we're all different. And when we think of at the cellular level, what's wrong and what's going on, and then we pick the right sequence, fix the inflammation, get rid of the senescent load, fix the mitochondrial dysfunction before we go on to building. It's just like building a house. We need a great foundation. Take out the trash first, and then before you build the wall.
When you were saying that, I was literally thinking about, it's kind of one of the analogies I use with our patients in my office is like, hey, look, you want to do this regenerative injection, even something simple as like a PRP, even that, it's like, look, you want to build a new building,
right,
and the neighborhood around it's on fire. Right. Like literally there's fires going on, there's alarms going off, the concrete is crumbling. It's like, we need the foundation, because if not, that new building is probably going to crumble too, right? You may only feel some benefit for a short period of time, and then you're disappointed. So people have to know, it's like, look, we're going to help you, but you also got to help you got to help yourself too.
And even like the extra weight is so inflamed, and the load in the joint. So it doesn't matter, how much stem cell, exosome, or stuff that you put in there. it's not enough, right? So I really think the important point is there's no one single magic thing. And I have to say, I'm like a kid in the candy store. There's so many powerful tools out there, but we have to use them responsibly and with the right sequence, the right combination to give the best outcome.
Yeah, got to be the right everything, right?
Right.
And the day is about getting people better. So this has been great. Yeah, I really appreciate it. So for those listening to this podcast who are not familiar with you, where can we find you? Where's your clinic? How can we learn more about the work you're doing and all the great things you have going on?
Yeah, absolutely. So I have a clinic in Austin, Texas, and just look me up at austinregion.com.
And are you on social media as well?
Yes, it's a Region with Dr. Nguyen.
Okay.
Is my IG handle.
Okay. We will definitely check that out and make sure we'll put that in the show notes so people can learn more. So again, I want to say thank you. It's finally, it's been so long.
It's
I get to kind of hang out and everything like that. Thank you.
Yeah.
All right, guys, that's been our first ISSCA Dr. Jones Optimization Academy podcast. We're looking forward to doing more the rest of the day. And check out Dr. Nguyen, learn more about her. She's a powerhouse in the regenerative medicine space. And until next time, we'll see you soon.